here. Would you like to see more external operators like the minor injuries unit staying open, which was a very popular local service?
Well, let's be clear. If I'm Health Secretary after election, the biggest single change we all need to see is a transformation in community services. When you're dealing with terrible tragedies like Mid-Staffs and Morecambe Bay, obviously your focus is going to be hospital care.
Yes, yeah.
And I think the NHS has done fantastically well, and I think you can see that in this hospital here. But the next big change we need to see in the NHS is a transformation in community service, particularly GP provision. We need. It's not about asking GPs to work longer hours, because they already work very hard, but we need more GPs, more district nurses, more community nurses, more practice nurses. We need properly integrated care. You have in Ipswich an MP who has campaigned incredibly hard for both hospital and community provision.
But we've seen things like the minor injuries unit, which was used by thousands of people every year, closing down because the money wasn't there, and people being told to come to accident and emergency.
Well, I think it's important not to take these things in isolation. What you've also seen over the last 5 years is an A&E department in this hospital expand to deal with 20,000 more people every year within the 4-hour target. So where people receive their emergency care isn't the issue. What's most important is that they receive it. But I would say that you need to go further, and actually we need to prevent people needing emergency care in the first place. I think talking to the doctors here, too often you'll have someone who's in their late 70s who perhaps has a fall in a care home in the middle of the night and ends up coming here and being admitted to hospital. And if we'd looked after them better in the community, they wouldn't have needed to come here.
So the council is withdrawing the children's services from that building because the NHS has put up its rent by 400%, and it was the most popular children's centre in the town.
Well, I don't know the details of that particular case, but I'd say that in general, the big change we need is to see the NHS, the community care, the GPs and the local councils all working together as one team. In Ipswich, you are going to have many, many more people in their 60s, 70s and 80s over the coming years, and they're going to need help from all the different agencies that provides health and social care.